Africa, like the rest of the world, has had its own fair share of a raging pandemic. Lockdown, stay at home, hand washing, face mask, or keeping social or physical distancing. Those are the hard realities that the continent has had to deal with. On the show today, we will be looking at the one thing that has got the world talking, disturbed, and for the very first time, working together, the pandemic. I'm Sulaiman. Welcome to VSA. Pretty much about the continent, which is just going through what the rest of the world is dealing with at the moment, looking at the raging pandemic. Pretty much a whole lot to do with what we are looking at the moment. In 11 months, close to 60,000 Africans have died from COVID-19, including certain and past head of governments, not too good a story, and the commoner on the streets. Now, with the threats that the economic gains of the past years will be eroded in the pursuit of survival, a much dreaded second wave has come with high tides, recovery at the back, survival on the forefront. Africa's mind is set for the future, but there's a long bridge to cross. Now, the rest of the world has looked towards Africa with some sort of envy, as the weak medical systems were thought to be a huge challenge. But the continent has risen above obstacles, recorded some losses and dead reality. Today on the show, we'll are discussing with two great Africans. And of course, Dr. Peter Imoesi is a research fellow at the University of Aberdeen in Scotland. And Dr. Moses Masika, a virologist from the University of Nairobi, Kenya. Gentlemen, welcome to VSA.
Thank you.
All right, okay. I'll stay with you, Dr. Imoesi, until Dr. Masika can join us. There were lots of apprehension going into the first wave, especially after the first sub-Saharan case was recorded. Many didn't see Africa or sub-Saharan Africa coping with the weak medical systems. We had that conversation some weeks ago, but somehow the region looks to be doing better than expected. Why do you think Africa has coped significantly despite initial fears?
So when it comes to the second wave, as said in the media, for me, I'm of the opinion that when it comes to the second wave, Africa, basically, we're not in the second wave. And the reason for my assertion is the fact that when you look at the testing pattern in the continent, especially in most of the West Africa countries, you realize that if your testing is not so consistent over time, you can't basically say that you've left the first wave or you're now in the second wave, basically. But when it comes to the health infrastructures within the continent and putting Nigeria into context, fine, we know we have deficit in these areas, but somehow I think, will I say, we were lucky not to be so severely hit by this particular pandemic. But if we are to go by what we have on ground, then I don't think we have the necessary machineries to weather the storm going forward.
Let me bring in Dr. Moses Masika quickly here. Dr. Masika, listening to Dr. Imoesi, he's saying perhaps this looks like maybe Mother Nature smiling on the continent, as against people thinking that the experts on the continent are doing a very fine job of containing the spread of the virus. We understand that the variants of this virus is virulent in different proportions. So as researcher, have you ever considered the possibility that Africa has been battling perhaps a variant that isn't as virulent but yet to be discovered?
Indeed, those questions have been raised, and we may not have a definitive answer until we analyze as many sequences as we need to. But we know for sure, even in this current news worthy strain, the B117, there's one particular notorious mutation that has been identified in that strain and is also in other strains in South Africa. So I wouldn't think that we have weaker strains as such. What I think we probably had was an initial slow rise because of poor, I would say, seeding. If you look at 100 people traveling anywhere in the world, only 3 are from Africa. That means if you have 100 COVID patients traveling anywhere in the world, only 3 are coming into Africa. So the initial seeding was quite slow. And people, because of water and other parts of the world, people got, I think, sufficiently concerned and sometimes fearful and took measures early. And I don't think it's the experts only. The measures that have been working are very easy. Washing hands, social distancing, masking, and because they are not necessarily resource-intensive measures, they may have bought us a break initially. But this means that if we drop the ball and do not follow these measures, we could suffer the same that the rest of the world has. So there may be other factors that we do not understand yet, that Africa has been spared, and that's why we need to keep collecting more information. But I don't think it's likely that we have very different strains circulating because our strains have come from all over the world. The introductions into Africa has come from very diverse sources in the world.
Well, I think quite an interesting perspective you've raised there, Moses. Let me go to Peter because we've been talking about, testing abilities for the continent. Just let me remind us, just yesterday, Nigeria recorded the highest in a single day, just short of 1,999 confirmed new cases. Dr. Imoesi, listening to Dr. Masika, what comes to mind has to do with, again, some of the things we have raised on VSA, the continent's testing abilities and how this can be, improved upon. Unwrap this for us and so that we can make sense of what we are dealing with at the moment, even though Nigeria is alarmed at the new rate.
I think Dr. Masika kind of elaborated a few points when it comes to the variants of the virus we have in Africa. But the point is, Africans do travel. So when you look at the flight history on daily basis, you know that there are a number of inbound and outbound flights within all of the countries in Africa. So let's establish that. So if you have 100 passengers, basically half of that particular flight may be heading to the continent, and Nigeria in particular, South Africa. Back to the issue of testing, right? Recently I read somewhere on the mainstream media where someone was saying that we do collect samples in the Federal Capital Territory, and these samples usually they sit more than, let's say, 2 or 4 or 5 or at best 2 weeks before people are able to know the status of their COVID-19. Now, the implication of this is really simple. So basically, when it comes to the testing of your sample, there's a component that is required within that your sample, and it's called the ribonucleic acid, which is the RNA. Now, this particular molecule is highly unstable. So if you leave your sample for more than a period of, let's say, 48 hours, you're already risking the integrity of that sample. Now, when you then go ahead to do a test on that sample, chances are that you're going to pick a negative result. Now, for the fact that that sample is bringing out a negative result does not imply that that individual is negative. It's because you've compromised the integrity of that sample, which then leads to a false negative result. And of course, when you see the number of cases we've reported in Nigeria, we have high number of negative cases compared to the positive cases. And as at my last check, we have about 77,000 cases which are positive over time for the last 8 or 9 months. So what this implies is our testing strategy is not so holistic, that is one. Then 2, the required machinery to carry out these tests effectively is not there as well. And I think Nigeria can be used as a model to other African countries in the continent. So if you have this particular peculiarity, and difficulties in ensuring that you have your sample well preserved and the analysis is done within 48 hours, then you start reporting the numbers you have as high number of negative cases compared to positive. Now, on the other flip side is where you have, if these individuals that receive their results a little bit late, let's say 2 weeks, it implies that if I don't know my status, I will move around freely. And in doing so, assume I'm positive, it means I'm going to spread the virus to the neighboring people around my bubble. So basically, delayed testing leads to high rate of infection within a community. And based on that, we can emphatically say that the virus is actually within Africa. And the only thing we have is that we have a relatively young population of about 18.1 when it comes to average median age. Whereas in the UK, for instance, our average median age is somewhere around 45 to 50. So you have an older population in the Western world, whereas you have a younger population in Africa. And you know very well when it comes to this particular virus, the younger population are actually doing well when it comes to the infection rate compared to the older population. So if we are not reporting the number of deaths in the continent, it's not because we are doing something right, it's because we also have a relatively young population and other factors may be playing to our advantage.
Thank you so much for doing this for us. I'll take this as scary and as worrisome as this is. It boils down to the poor state of infrastructure, medical infrastructure in the continent. For a sample losing its integrity owing to the absence of such infrastructure in the continent is something that should also tilt towards leadership now. Dr. Masika, perhaps especially now that the Kenyan medical practitioners are going on strike. Tell us truly, let's get an update from you quickly on that. Is the strike still on in Kenya?
Yes, indeed, the strike is on, and this is a strike involving all medical doctors, pharmacists, dentists, clinical officers, nurses, and basically the entire workforce in the facilities. And this, for example, comes after these healthcare workers had given very long notices of a strike, some as long as 35 days, and nobody really bothering to talk to them. And what we've seen over the last few days is a callous approach from the leadership, where healthcare workers are threatened with the sack or other threats or intimidation to try and get them back to work, instead of addressing the real issues that the healthcare workers have raised, which to many people actually appear reasonable. And the healthcare workers have dug in and said that they would rather face the sack than go back to work without the protective gear, because that would mean death. And they prefer to be jobless than to be dead. So we have really, I would say, a very callous approach to the whole strike. And I hope that changes. Otherwise, we are looking at a prolonged holiday without any doctors and other healthcare workers.
Dr. Masika, I'm afraid, in other words, we can't rule out the importance of leadership in the fight against the pandemic.
It's for sure one of the things that plays the greatest role, because the leadership gives a mood, it gives a posture. And for example, we've seen countries where the leadership has taken a lackluster posture to show that that seems to communicate that COVID-19 is not as serious as it is. The population takes the same attitude and the disease spreads faster, leading to disasters. And we can mention several countries like Brazil and other places where the leadership took a very lackluster approach to the infection. And even in our own country, at some point, we were dropping the ball because politicians were having rallies left, right, and center until these rallies had to be banned, because what the leadership portrays is what the population takes. Additionally, there have been issues with resource allocation, resource utilization, with questionable corruption deals and things like that, which also communicates the wrong message, but more importantly, take away resources from where they're supposed to be, and that is in the hospitals, taking care of patients. So if the leadership is not right, one of the things I think some of the governments have done very well, the leadership, is taking advice from scientists in terms of which measures to take. But beyond that, there has been empty rhetoric in terms of engaging more healthcare workers, getting some of the facilities in place, and also portray the seriousness of the situation. Because what we see, for example, in my country, is people going to gatherings, say burials or other rallies in very huge numbers, and sometimes throwing caution to the wind by having multitudes together in very precarious situations, which could form super spreader events. And so this kind of posture, where the leadership doesn't seem to give the seriousness to the disease that it deserves, ends up misleading the population in as much as we are saying that the disease is still here with us and we should take care and prevent it.
A fine place for us to go on the break. When we come back, we'll be asking questions. Can Africa be 2 times lucky to get off the pandemic? Join us again. Welcome back. Can the continent be 2 times lucky? Several African countries are taking steps already to ensure the spread of coronavirus is limited. Public gatherings are being cancelled, expected numbers being reduced, schools are being closed, and potential lockdown on the fringes. In Kenya, where Dr. Masika is, the parliament has voted to cease the tax relief granted to citizens and business owners there. This has been met with criticism. Vaccines are expected as from January next year, with both Moderna and Pfizer at the forefront in production. Let me start with Dr. Masika. After the announcement of the cessation of tax relief by the Kenyan government, what's the mood and reaction like over there in Kenya where you are?
There is, of course, a bit of complaints from the general population. And this is because the tax has been reduced, the top bracket from increased from 25% to back to 30%, which is quite a chunk of the money to be lost every month. But in as much as that is an issue, there is a group of people that do not necessarily benefit from the tax relief. And this is the informal sector, which forms a large part of the population. And this has been neglected for a while with very little support. So we have 2 groups. Really, one is getting the belt tightened on its behalf, and another group that hasn't seen much relief from the government, despite the fact that they were engaged in businesses that are no longer viable. And because they were an informal sector, it's difficult to quantify it, except to know that this is a very large group. So the complaints have come up. And we're expecting that once the measures are implemented in January next year, there will be more discussions on this as the reality comes to bear. But I'm more concerned also about the people who have not necessarily do not pay taxes because, do not pay salary tax. They pay other taxes like as VAT and what have you, because this is a larger group and they tend to have more job insecurity and less income. And so we'll have very few cushions to help them.
I think it boils down to what we highlighted earlier on, the issue of leadership on the continent. Now, Peter, many researchers like yourself are of the opinion that 1 shot of the vaccine may be all you need to confer immunity. Can you shed more light on that?
When it comes to the vaccine, it's not actually 1 shot. So for the Pfizer and the Moderna, you have 2 shots. So the first shot and 2 weeks after the booster shots for you to get the 94 or 95% immunity. And that basically is, even though you go ahead to give that particular shot, it means that you still have to keep adhering to the non-pharmaceutical interventions, which is a face mask, hand washing, social or physical distancing, as it were. So the vaccine for now, it's not a kind of a silver bullet approach, because it's going to take a little while before you get the large population vaccinated over time. And do not forget that also you're going to have people who are going to resist this particular vaccine again. You have to factor that into here before you say, oh, once we get this vaccine, we have a covering all among the people around the world. And again, when you integrate that into Africa, for instance, you know fully well that for the Pfizer and the Moderna, the temperature at which you store this particular vaccine is at -70. And when you do that, basically, and you alter that particular storage capacity, the tendency for you to alter the drug itself, which is the vaccine, is there. So the question here is, do Africans or majority of the African countries, except let's say South Africa, do we really have the required freezers to store this particular vaccine once it arrives? And if it does, do we have the necessary dry ice to move this particular vaccine from the west to the north and from the northern part of Nigeria to east and to the central part of Nigeria as well? Now, when you look into these particular angles, we should be aware that by now we should have in place already structures that will enable us to move at a fast rate. So the same sort of mistake we had in the early days of the lockdown, and as regards to testing, is the same sort of mistakes we're going to encounter going forward when it comes to the vaccine. And basically, I will advocate that if you really want to go ahead to take the Moderna or Pfizer vaccine, the government should put in place careful measures to ensure that the vaccine you're giving to this individual is the actual vaccine and there's no alteration in the vaccine based on your poor logistics.
Is the vaccine for everyone? This is to you now, Peter. Is the vaccine for everyone? Are there people or category of persons exempted from taking the vaccine?
So far, for the Pfizer, we had a few cases in the UK where some of the health workers that took the first jab reacted severely to allergies. So now, Pfizer are saying that if you have allergy, do not take this particular vaccine going forward. That is one. Then two, I was trying to read into their document recently, and they also explained that if you have other immunogenetic issues that has to do with cross-reaction with the components for which this vaccine is made, do not take this vaccine as well. So the point here is the vaccine is good for people. I think for Pfizer, 18 and above can take the vaccine. For Moderna, 16 and above can take the vaccine as well. But what we need to do in Africa countries is for us to ensure that the content of this vaccine is well studied by our own researchers. So we shouldn't just sit back and listen to what the mainstream media or scientists around the world or in Western countries are saying. We need to acquire this information, go through them carefully, and study what this entails for us to know if this will be beneficial for our own kind of people and race.
And our closing moments here with you, Dr. Masika, is that we hope that what is happening in Kenya at the moment will be, sorted out so that the medical experts will return to those medical facilities that are ultimately empty without experts. Well, we may have Dr. Peter and Dr. Moses here, but on VSA, we're not living in denial of the effects of the COVID-19 pandemic. So it's very much around. And I'm so excited that both of you have been able to unwrap this so that people on the continent can have a fair and firm understanding of what this is about. The vaccines available have been tipped to be the biblical Moses that will help the world to cross the Red Sea of coronavirus. But even in the face of that, we have to help ourselves. Stay safe, stay at home, enjoy the Yuletide by staying healthy and do the right thing. Many thanks to you, Dr. Moses Masika and Dr. Peter Imoesi. I'm always excited having both of you, unwrap matters of health for the continent here on VSA.
Thank you. It's a pleasure.
Well, thanks for joining me, and don't forget to watch us live at newscentraltv.africa and on YouTube at youtube.com/newscentraltv. I'm Sulaiman. See you again.